Hi, my name is Brianna Graham. I'm happy to have the opportunity to present the findings of the New Hanover County Community Assessment. If you are unfamiliar with where that is located, it is the red area in the state of North Carolina that I've placed right there for you to see. As you can see, it is right along the water. That makes it a popular tourist destination throughout the hotter summer months. It has over 4 beaches for those tourists to enjoy, as well as the Battleship North Carolina and many breweries around town. The population for that area is 232,274. Majority of those people being between the ages of 18 and 65. And then 57% of the housing units are occupied by the owner. So that's significant because the remaining percent is said to be summer vacation homes, beach houses, but majority of the year they are not occupied. Part of this assessment included 2 interviews. That was with the Public Health Director, Mr. Philip Tart, and the Health Promotion Supervisor, Ms. Caitlin Matney, and a windshield survey. So from that, we gathered that Hurricane Florence repairs are still happening, and it really showed the resiliency of the community to overcome such a tough time. It took place back in September of 2018. Another finding was the growing opioid epidemic. The Castlight survey showed that Wilmington was #1 in the nation for this drug problem. And so since that time, a lot of resources and light has been shed on the situation. 21% of children in the community are living in poverty, and of that percent, 12% are white, 46% are Hispanic, and then 50% are African American. Another finding was that more sidewalks and crosswalks were needed throughout the county. As you can see in the photos, those are my photos, I took those. People are forced to cross the street without the safety of a crosswalk, and there aren't any crosswalks for a couple blocks, or there just aren't any at all in that location. And another problem that the county is currently facing is a lack of affordable housing, and as I stated before, still recovering from Hurricane Florence. That didn't really help the situation. It actually increased the problem for the lack of affordable housing. The theoretical framework or logic model that I chose for this assignment was the mobilizing for action through planning and partnership community assessment model, which is the MAP model. And I chose this because it has 4 different assessments, and it really provides a overall view of what the county may be going through from different perspectives. So the first one, the community themes and strength assessment, that is designed to gauge the resident perspective on community issues and resources that currently exist in the area, while the local public health system assessment focuses on healthcare facilities in the area. The community health status assessment is actually conducted every 3 years by the local health department in collaboration with various partners, including the New Hanover Regional Medical Center. The last assessment, the Forces of Change assessment, aims to identify events, trends, or changes that will occur within the county that will affect the overall health status. And phase 4 is very important. It combines different community leaders and stakeholders to come together and view the data that was generated from these different assessments and actually interpret it and help the community understand it better. So the county health profile revealed the top 4 leading causes of death in the area to be cancer, diseases of the heart, cerebrovascular diseases, and chronic lower respiratory diseases. For cancer, New Hanover County reported a rate of 449 persons with a new case of cancer per every 100,000 residents from 2011 to 2015, while North Carolina as a whole reported 461 new cases per every 100,000 residents. Diseases of the heart in New Hanover County, 60% of hospital discharge papers showed that for residents ages 65 years of age and older are attributed to some form of heart disease, while the state showed the same rate. However, when you look at the death rate that is attributed to diseases of the heart, New Hanover County reported a rate of 416 per every 100,000, while the state reported 422 per every 100,000. For cerebrovascular diseases, more commonly known as a stroke, New Hanover County reported 25 per every 100,000 residents over the age of 65 that are hospitalized due to a stroke. And then the county also, or the state, also reported a rate of 25 per 100,000. This also revealed an interesting discrepancy for African Americans within the county. They experienced a rate of 40 per every 100,000 residents. And then chronic lower respiratory diseases, the most common being chronic obstructive pulmonary disease, COPD. North Carolina ranks in the second highest categories for the prevalence of COPD. COPD is actually a term used to refer to a group of illnesses that obstruct the airway. This includes emphysema, chronic bronchitis, and asthma. And as you can see, risk factors that influence this in the childhood years are pneumonia, allergic rhinitis, childhood asthma, eczema, maternal smoking, and parental asthma. The next step was to gauge community assets and capabilities, which New Hanover County had plenty. They have the New Hanover Regional Medical Center that you heard me mention earlier. It's the local hospital, and it's actually a group of physicians that have various locations throughout the county and surrounding communities. New Hanover County Health Department has over 150 employees tasked with promotion of health within the community. The Southeast Area Health Education Center, more commonly known as CHEC, is part of AHEC, which is the Area Health Education Center. And they have different locations throughout North Carolina, and their task is to educate the educators. So they help with educating physicians and health educators and different professional workers throughout the area. Coastal Horizons focus on mental health and substance abuse, while Trillium focuses on mental health, depression, and suicide. Wave Transit is the local public transportation system that residents are able to use to get around New Hanover County. And then the two main educational facilities in the area are the University of North Carolina at Wilmington and Cape Fear Community College. So the findings revealed the 4 leading causes of death and that the county's public health strategic plan correlates with the community health assessment. It also shows the need for more crosswalks and walkways. And that actually has 2 roles. It not only promotes health, but it also promotes safety as well. A limitation of this assessment was the inability to observe the entire population. New Hanover County is very big, and the main focus of this took place around Wilmington, which is just one city in New Hanover County. There's also a lack of information for the Hispanic population in the area, and it is a growing population, so we would love to see more data for that. A strength is that the data from both interviews and the windshield survey and information that I was able to find online, they all align. So it's great when you don't have discrepancies in your data. And then the availability of data, because the county is so urban, the data was readily available through searches, so it made the assessment easier. Recommendations include implement a program to help residents stop smoking and prevention of new beginners from smoking, and that is to prevent the COPD problem in the area. They should also monitor environmental pollutions. There are many factories within the area, and those need to be monitored. And then a county exercise program for the prevention or maintenance of COPD could also be implemented in the area to help prevent the COPD problem. Thank you for listening. I hope you've enjoyed it, and I've enjoyed my semester with you. Thank you. Have a good day.